Hi, my name is Luis Paladines, and now I'm going to talk about cerebral metastases. First, we have to know what is cerebral metastasis. So, cerebral metastases are tumors that develop in the brain but come from a tissue or organ located outside it, have a different ability to metastasize to the brain and must have the ability to penetrate the blood-brain barrier. They interact with the resin cells and survive. Now we are going to see a short video.
What is the role of radiation in the treatment of brain metastases? This is one of a series of cancer videos on the website aboutcancer.com that explore the role of radiation in treating various types of cancer. Brain metastases are cancers that start elsewhere in the body and spread secondarily to the brain. These are distinct from primary brain tumors such as gliomas. These are common in patients with stage 4 cancer, particularly patients with cancer of the lung, melanoma, or kidney that commonly spread to the brain. The most common source for a brain metastases will, however, be lung cancer or breast cancer. Generally, the upper part of the brain is affected, the cerebral hemispheres. The symptoms of a brain metastases include headaches, weakness, mental change, or seizures.
Application in medicine. Studies has been carried out to assess whether the danger and generalized brain radiation versus its benefit justify its use and added method to radiosurgery therapy, or whether it alone already provides the best possible treatment. But the negative aspect outweighed any possible positive effects and widespread radiation.
It's very early on in a movement to really address the treatment of metastatic cancer and metastatic brain in particular. The importance of a film like this and the American Brain Tumor Association being a part of it is really gets back to our mission. If people understand that there is time for them to understand their tumor, that there is time for them to understand that diagnosis, and there is time for them to better understand their treatment options, it's a better trajectory, it's a better outcome. And I think that that is a mission fulfillment for the organization.
If we give treatments that are toxic and cause cognitive decline, then those patients won't be able to enjoy the extra years that we've bought them with our new therapies. And so when treating cancer patients in the modern era, we really have to consider the quality of life for the time they have left.
We want for people to continue to live, continue to work, continue to do all the things that are meaningful for them.
Radiosurgery is an essential component to the next wave of cancer care.
I no longer think about dying, I don't. And that's, I think, pretty dramatic.
If we can give you that plateau of survival, imagine what new protocols might be available to you that weren't available even 3 years ago. And that provides patients with realistic hope.
Technology has evolved to the point where we can treat them quite well and often cure their intracranial disease. Most patients with cancer who have brain metastases are going to find that their ultimate prognosis is really dependent on what's going on with the cancer and the rest of their body. The future is really bright for these people because our systemic therapies are really progressing and survival is better than it ever has been in the past. I think the future is really going to be changing cancer from a fatal disease to a chronic disease.
Pros and cons. How pro we have two multimodality of treatment which allows to prolong the survival of the patient and better quality of life by reducing the probability of recurrence and or recurrence. In cons, we have a high rate of immediate mortality or morbidity of each therapeutic variant for each treatment group and possible complications. Problem applied in Ecuador. The treatment of choice is olecranial radiotherapy, demonstrating improvement in symptoms of prolonging lifetime. However, in Ecuador, there are no studies to indicate approximate survival in patients with brain metastases. The incidence of brain metastases has increased in the last 30 years. Diagnosis imaging studies are implemented, which allow the early detection of these brain metastases. In conclusion, the survival time achieved with the application of the treatment must be taken into account or related to the most widely used prognostic indicators. It is a major medical problem as it in this is high and the prognosis remains poor. The blood-brain barrier, together with a series of mechanisms, gives it special protection characteristics. While these mechanics may be effective, they also turn out to be additional complexity in selecting an appropriate therapy. For the conclusion, we are going to see a short video about cerebral metastases.
Cancer, the emperor of all maladies. It is a frightening disease for which currently there's no cure. However, we are unquestionably in one of the most dynamic and exciting periods of medicine for cancer treatment.
I felt that something was a little off with my right breast. It turned out to be breast cancer. I went through 7 months of chemotherapy, a mastectomy, radiation. I got to a point where there was no evidence of disease. My oncologist suggested a brain scan because I hadn't had that tested since my original PET scan when I was first diagnosed. There were 3 tumors.
A brain metastasis is a collection of cancer cells that have traveled from some part of the body where it started.
They cause a lot of swelling, and that pressure on the brain and the swelling in the brain causes neurologic symptoms and can actually even cause death if not treated appropriately.
First thought was, okay, what's going to happen next? What's my quality of life going to be? And actually, I was prepared to die.
And it's terrifying. They're scared that they're going to die soon. They are scared of the treatments that we might be offering them.
We did a study a number of years ago where I took my own patients and I tried to predict how long somebody would live, and we shared that data with 17 top people in the world. It was fascinating because what we found is that the doctors really couldn't pick at an individual level who was going to beat the odds and who was going to struggle. Maybe we're not that good at predicting how long people are going to live.
We'll find the cure for cancer eventually, but in the meantime, we want people to be able to live with their cancer as opposed to for their cancer.
We now have capabilities in radiosurgery to treat tumors that are in deep and inaccessible areas with almost relative impunity. We can do it with such targeted approaches that the side effects are no longer significant.
This has revolutionized neurosurgery and radiation oncology because prior to that, there was only the options of open surgery or radiation to the whole head as opposed to.
Thanks for listening, and I